Good evening. Welcome to America's Heroes Group Roundtable live stream digital media show. I'm your host, U.S. Army Iraq combat medic and flight surgeon, Colonel Dr. Damon Arnold, U.S. Army National Guard retired. Tonight, I have a very, very special guest, Amy Maxmen. She is a Kaiser Family Foundation Health News Public Health local editor and correspondent. This is really an incredible discussion. She wrote an article, I think, that is something that everyone should read. I subscribe to the Kaiser Family Foundation Public, the Health News series, and every time I read it, they have some incredibly in-depth reviews of what's going on in our health system. What a U.S. exit from the World Health Organization means for global health is an article that she wrote on January 24th, 2025. I implore you to read this. It is really very well written and very informative. And it's something that's been keeping me up at night, the World Health Organization, something that Reagan supported, multiple people were supporting this organization from president to president to president, and has done incredible jobs eradicating smallpox and such other things. But how are you doing, Amy? Because this is just such an important topic that you're covering.
Thank you for so many kind words. I am delighted to be here. So thank you very much for everything you do. And I'm doing all right.
Great. So tell us about this, because you were saying that the World Health Organization is shaped by its members. It was like 194 countries. I didn't realize that with that many countries that were involved in this. And it sets the health priorities and makes, agreements about how to share clinical data, treatments, and vaccines during international emergencies. So multiple things that they are involved in. But tell us a little bit more about what you found.
Yeah, so I think, the reason why, there's a few reasons why I would say, and, your introduction is exactly right on. This has been, across the aisle, presidents have supported our belonging to the WHO. I've talked to people who are in the Bush administration for this story. So a big reason why is right, because as a member and actually as one of the largest donors to WHO, as a member, that's how we get to shape what the WHO does, how we, when the US wants reforms, the US has a lot of sway actually in what happens and also in what agreements should be in place. So there's just sort of a lot of clout that the US has traditionally had at the World Health Organization. And so the fact that, right, so the way to shape the organization is as a member. It's actually the only way to shape it. So that's the reason why it's relevant to know there's 194 countries in here. So what I found from talking with people, and these are like health policy analysts and experts in foreign affairs and in public health, I would say there's a couple of reasons why everyone I spoke with is, thinks this is not a smart move for the US. One of the reasons is because of this power that we have a lot of clout at the WHO, and that also helps shape sort of, what happens in global health around the world. And by us leaving, we're roughly around 15% of the budget, but other countries will fill the vacuum. And so I talked to some experts who are, some, not all of them, but some are concerned that, other countries like China might be the ones to fill the gap, and then they will shape the agenda. The other reason why it's bad is for the other thing you mentioned is that the WHO does a lot of things. They fight outbreaks in places where the US doesn't really have a ground presence. Like, for example, I was in Eastern Congo in 2019 during the second largest Ebola outbreak. Yeah. The WHO was there. They were staying in hotels that had actually, been hit by grenades. The US wasn't there at all. So the WHO operates in regions that the US doesn't necessarily reach. I should say, when I say the US, I mean the CDC and USAID. So they're in regions we don't go to. And in a selfish sense, if we're worried about certain outbreaks, it's better to stop those outbreaks where they are and so it sort of endangers Americans to make this group that is quite good at trying to combat outbreaks spreading in other countries from spreading further.
Yeah, that's one of the things that they were criticized for their handling or mishandling of the COVID-19 pandemic. And it really echoes what's going on with Project 2025's priorities, a mandate for leadership. Um, and this was really, produced by the Heritage Foundation. But actually, they eradicated smallpox. They were involved with trying to eradicate polio now, globally, and they are involved in giving HIV care, trying to stop the spread of a disease that can be devastating. um, and as you were saying, outbreaks like Ebola, right now in Uganda, they are dealing with a particularly viral form of the Ebola virus that they are concerned about. But by stepping back, you also supplant the intent of what we were doing as the United States for being there in the first place. Having the ability to put in safeguards, like we have the Environmental Protection Agency, we have other safeguards that we have as a nation, based hopefully on moral principles that are sound. But if you bring a China in that really has disregard for many of its citizens as far as pollution goes, as far as its approach to healthcare and denying things that were happening, that could have a devastating impact on the World Health Organization's balance of ethical considerations. I'll put it that way. So not being at the table is not an answer.
Yeah, exactly. I think that's and other executive orders that are related about foreign assistance is sort of about an America First policy. But more than one person brought up, this isn't good for Americans. This is actually not an America First policy to step back. And to address your concern, it is true that in the executive order, President Trump, pointed out that, or said that the WHO mishandled the COVID pandemic. Also, that echoes Project 2025 saying the same. And WHO did make some mistakes. For example, I think they could have been quicker to say that the coronavirus was airborne and that masks help prevent spread. So they, definitely are not completely blameless. I don't know actually a health organization that isn't, but they did do a lot right. They talked to the press constantly. They vetted a lot of diagnostic tests and treatments. And moreover, the US did really poorly with COVID. We had one of the highest COVID death rates in the world.
Yes.
That is not on the WHO. On January 30th, the WHO they don't actually, until now, they didn't have a declaration of pandemic. They declared their highest alarm on January 30th. Public Health Emergency of International Concern, or FAIC. Some countries responded really aggressively, like South Korea rolled out like a ton of tests immediately, and New Zealand. So a lot of countries were really quick to respond. The US did not. The US kind of put in half-hearted travel bans when it was, which are never, there's many studies showing they're never, really effective at all. Like you want to do domestic measures. So the US, I think, in a way, President Trump might be trying to displace blame on the WHO and its internal problems that were there.
Yeah, because I was really surprised. One of the things that you mentioned, it was a quote from, Project 2025, and it was saying that the Biden administration has deformed the agency, which means the WHO, by treating it as a global platform to pursue overseas a divisive political and cultural agenda that promotes abortion, climate extremism, gender radicalism, and interventions against perceived systemic racism. And it's really bizarre that you would put that in as being the criteria that you're looking at with WHO operations globally. It deals with other things, like polio and tuberculosis and HIV. Malaria is another big thing. We're actually seeing some cases in the United States now that are reporting in the southern portion of the state of the country, and then also in California. But we have measles and other diseases, and they are involved in making sure that vaccinations occur globally. So this has implications. If you take away the funding from the World Health Organization, you're actually allowing people to die. I mean, in Gaza, we can see what's going on now with the humanitarian crisis there in Sudan and the Democratic Republic of Congo. And these are some areas, like you were mentioning before, we don't really go into. These are places where the U.S. government really does not operate. So in order to protect the global, the entire country, the world, is to make sure that we're at the table.
Yeah, exactly. And so, that's another reason was given was the WHO hasn't reformed. And, a lot of my sources sort of pointed out why they're not really buying the reasons given in the executive order. And if we wanted to reform, if the Trump administration wanted to reform WHO in a particular way, it'd be one thing if, after a year or 2 years of being within the agency and pushing, they didn't get specific reforms done, but they haven't done that. And there's no way to reform it from outside of it. And the WHO has actually undergone a number of reforms.
Yeah, that was really interesting because you had mentioned that President Trump in his first term, had suspended funds to the World Health Organization in 2020 and had provided a termination notice, and so the U.S. contributions to that point hit a low of like $163 million.
Exactly.
And when Biden got in, he restored it to about $481 million, back in 2023. But that type of thing, the fear I have is that there's talk about whether that termination notice, because you have to give the World Health Organization 1 year before you withdraw, whether that termination notice is in effect and can still have legal weight.
I think that there's so many unknowns at this current moment. So sort of one of them is right. So there's this sort of rule, but it's not in the WHO constitution, but there's a sort of rule that, right, you have to give a 1 year notice. And the fact that the executive order recalled the first Trump administration giving their notice then, I think the argument is that they're going to say that they can withdraw right now. I know already there's kind of a weird situation where like there's, CDC, there's a number, I think something like 24 CDC staff who are actually in Geneva at the WHO who aren't allowed to talk to their colleagues right now at the WHO. So it's sort of in effect, will this be fought? I'm not really sure. It's not like the WHO enforces that, I hear. So it would be like Congress fighting it. I think the general sentiment that I heard was that this is going to move forward. But that's speculative. Surprises happen.
Yeah, and one of the things you were also talking about, the funds for the WHO represent about 4% of America's budget for global health, and it's in turn is less than 0.1% of the U.S. federal expenditures each year. You talk about return on investment. I mean, to have global health stability, it seems like a pretty small price to pay.
Yes, exactly. I think that's so important to stress that because I'm sympathetic to thoughts of like, why would we be spending money abroad when we have problems here? I think that's totally valid concern. But right, when you hear it's like 4% of 0.1% of the budget, it's a very minuscule amount of money. Yeah, so it's a very small amount of money. And the WHO, besides doing those hands-on things in countries, they're trying to like also, when you see the WHO within countries, they work closely with country governments, like in low-income countries where the government health system really does need support. And they're trying to make those health systems stronger so that they could be more independent on their own. And that's something that, a lot of NGOs kind of operate outside of the government. So the WHO really performs this important function. They also do other stuff like we have the FDA. Europe has like the European Medicines Agency, but a lot of countries don't have such strong government agencies that are vetting diagnostics and drugs and vaccines. WHO does that for a lot of countries. So they also kind of perform functions we don't think about. They also are kind of a big venue for sharing data with the world. So if, Indonesia says that there's a weird outbreak of influenza, this WHO that's going to kind of collect that data, be kind of this intermediary of information that's really important.
Yeah, I'm just amazed because getting back to the budgetary considerations when you're talking about all those additional things that the WHO does, their budget is about $3.4 billion, and they're about 33% of what the CDC gets is 9.3 billion, right? They're covering, and they're covering the entire world. I was the director for the Illinois Department of Public Health from 2007 to 2011. My budget was $800 million. That's almost $1 billion. So I had almost 1/3 of their budget to cover one state, Illinois.
Right. And that's
and that wasn't enough. I could tell you.
Higher payments under Biden to WHO. Yeah.
Yeah, it's amazing to me what they're doing, and we cannot allow this to sort of fall down. But they were showing that there were so many missteps, as you were mentioning earlier, about the U.S. Response to COVID-19. But even in that particular situation, I mean, the World Health Organization helped us, even though we had poor results, by making sure that the rest of the world was safe, because we're in a global economy now where planes go from place to place, and we are more connected than disconnected now in modern society. So that sentinel warning is so important for us.
Yeah, and I mean, I could point out too, in the end of January, they also, because once you have the sequence of the virus, so once we had the sequence of the coronavirus in early January, the WHO vetted different researchers around the world were making diagnostic tests that would detect the virus, and the WHO vetted them and kind of had on its website basically the recipe, more or less, for how you make a diagnostic test. Like, there was one made in Germany that was like a very good one, and they put that out there on their website so that researchers around the world could start working on making diagnostic tests. And a lot of countries went ahead and used Germany's tests. The US did not want to use it. We wanted to make our own test through our own CDC, which turned out to be sort of a botched test in the beginning. And then, we had you can't argue against one of our mistakes, which was our very slow rollout of testing. So this is to say the WHO was on it, right away, and we chose to ignore it. And it seems very clear that even if they make, they would do the same sort of thing again, they always make their information public. But it's clear that the US at this point would just not want to listen to what they have to say.
Yeah, and I didn't want to give much mention of this. The World Health Organization, I guess President Trump was saying that they actually helped to cover the tracks of the Chinese Communist Party, and I'm about where the origin of COVID was, from Wuhan, and it's just amazing to me. I can't even touch that particular.
It's good to bring it up because it is one of those. It's you hear this sort of misinformation from the highest level, so it's important to sort of confront it head on. And the WHO has actually called out China, especially now, for being slow to report the outbreak. China did obscure the outbreak, and especially in those earliest days, they've obscured origin investigations. They didn't do a lot of reporting in January that they could have. So WHO has pushed China to do it. WHO does not have the power to force China or any other country to do anything. So I think that's a misunderstanding that people have. They can't go in and tell a president to do something, just like they couldn't do it here. And another sort of bit of misinformation is that the WHO, through something they've been working on, or we have been working on with them until now, this pandemic agreement, there's sort of this misinformed rumor that it's somehow going to compromise American sovereignty. And just like, WHO couldn't force China's hands, they can't do anything to impinge on our sovereignty. They can't do that with any of their members.
Yes, right, yes. And there was also one thing that was, that really was really sort of parallel to this was the, the order for the U.S. to cease negotiations on a pandemic agreement, and what the implications were for the pharmaceutical industry. You were mentioning that as well in the article.
This is an angle I just personally find super interesting. So there were some researchers I spoke with who did mention this interesting angle. It's not for the reasons that Trump or the Heritage Project wants, in terms of like a silver lining, but the US has often pushed certain views or policies that a lot of other countries, specifically like middle income countries, don't like. So the US has, one of those is the US has long been a very ardent defender of pharmaceutical companies' patent rights. So there has been a push by like middle income countries, I'm thinking about like Brazil and South Africa and India, to say, listen, when supplies are short, let's say we're in an emergency and supplies are short. During the HIV crisis in the earlier days, there was not enough treatments, and the treatments were too, because there's a small, there's a small supply, prices are really high. Similarly, during the first year of COVID vaccines being out, there was a real shortage. So countries in the global south did not get COVID vaccines for a long time. And there's a research paper estimating that, more than 1 million people died because of the way that only wealthy countries had vaccines. So there's been a push to say, in an emergency, when people are dying and there's not enough supplies, more companies need to be able to make vaccines and drugs. And the way to do that is to say, these licenses need to be shared. There might even be royalty fees, but they need to be shared so that companies can make essentially generic versions of those things so that people can get the treatments. And so that was something that countries had pushed for. In the beginning, I think it's been sort of fought really heavily by the pharmaceutical industry, and also the US has also asserted that, as have a number of Western European countries. So that might not get through, but that's an example of an area where people said, maybe a little bit less clout from the US could be a good thing. That said, the shortage of money is going to be really tough.
Yeah, because, I'm thinking about the combination of this, thing with the pharmaceuticals and, not allowing countries to produce them, indigenously so that they can actually help their their populations, but that it also extends scientific research and the discovery of new things as well, which is really a bad thing to happen. But one of the things that you mentioned in the article was Oyade Alakija. He's the chair of the African Union Vaccine Delivery Alliance, and it's really interesting. This power is shifting hands that he was mentioning. And he says maybe that will give us a more equitable and fairer world in the long term. But I think that one of the things that's so important about your article is that it's also pointing to the fact that if we pull out of things like the World Health Organization, USAID, and those kinds of things, we actually change the dynamics in all these countries globally. And we're talking about power changes and structural changes and government changes and how people will respond to the U.S. We also leave a vacuum in which China can step in, where other countries can step in and supplant the position that we've had globally as a leader in the delivery of healthcare and medicine, right, and research.
Yeah, I thought that was fascinating. It's, this is why I like to talk with people from around the world, but for international stories. So the person you mentioned, she's Nigerian, and I think there is some thoughts that, it's within the US, people will immediately think a lack of US leadership is going to be a terrible thing. But she was just sort of saying, maybe not. maybe kind of the ideas, that we're hearing out of India or China or Indonesia, maybe that is what's coming up next. So maybe it's just sort of an end of an era where the US and European countries have had a lot of control. The kind of assumption I heard from a lot of people was that European countries won't fully fill the gap in funding because there's so much preoccupation with the war in Ukraine. So the thought is that Asian countries will sort of step up.
Yes. That's really amazing. I'm hoping that we don't lose the opportunity to stay on board.
Yeah.
That's going to be critical for our national defense and security. Globally too. And then one other thing you mentioned I thought was really interesting was the WHO has about 70 centers and hosts at U.S. institutions such as Columbia University and Johns Hopkins, and that is going to directly potentially impact their grant structures and how they get funded for research as well.
Yeah, and those are centers where scientists collaborate. And I think another fear is that other countries might follow in the US's lead. There is sort of, I think, in my opinion, a lot of the kind of fears about WHO are actually not based on real things. Like I mentioned the thing about, WHO taking away country sovereignty and stuff. Argentina actually just pulled out of the WHO as well. It's a small amount of funding, but the fear is what if other countries follow? And as one of my sources who's at the Council on Foreign Relations said is he told me, if we didn't have a WHO, we would have to create a WHO. There needs to be an international body for this.
Yeah, and that was it's the third executive order you mentioned in Article 2. I know we're running close on time, but it was really talking about the need to be in line with an American first foreign policy, which seems to be kind of antithetical to some of the positions we've just been talking about. The other countries may not see that as being a nice thing to say to them in the situation we're in. But we're running out of time. So, Amy, I just want to thank you. Thank you so much. I encourage people to read your articles, get online and the Kaiser Family Foundation, the health news. Make sure that you are a subscriber and read her article. This is so critically important that we stay informed, especially now. Thank you, Amy.
Thank you so much for having me on. I really appreciate it.
Alrighty.